quick question for you.
Okay.
Apart from my silly questions, what makes you smile instantly?
Probably a silly question. Probably cartoons,
Apart from that,
movies.
movies. Acha. Doctor, when we say ortho department, we see male doctors.
Yeah.
So what inspired you to become or choose that specific field?
Okay. So one thing is, as you were telling, orthopedics was a male department earlier, but then right now we have more than 350 female orthopedic doctors around the country.
Okay.
So initially, orthopedics is a department where we need a lot of strength.
Okay.
Probably 100 years back. But right now everything is machinery. We have equipment for everything, a drill, saw, everything is all machinery. So one of my professors told me, so whenever you're doing a surgery and you needed a lot of strength, then make it a point that your technique is wrong.
Okay.
So it's as simple as that.
Okay.
And then coming to choosing orthopedics is, yeah, surgery has been my passion right from my childhood. So I wanted to become a surgeon, and orthopedics is a really good subject. Probably, you know, the patient comes with to you with a broken bone, and then immediately you ambulate, do a surgery, you ambulate him.
Okay.
You know, that brings a lot of smile and happiness. Yeah.
Okay, this smile and happiness is because of that mending broken bone, or because bone is broken?
No, it's because of mending.
Achha,
Yeah.
okay. Doctor, sometimes there might be situation where you are outside and you are handling patient, some surgeries ho rahe hai, some junior doctors are taking your help.
Okay.
So you say, acha, attach this part of bone, remove this part of bone.
Yeah.
So, wo bone ko thod do, break that bone. It is part of your profession.
Okay.
So, is there any time when you are in a bad mood, you get a call from your husband and say, wait, I'll come home and break your bone?
Probably I should try this next time.
What exactly made you to choose your profession?
Yeah. So orthopedics, as I was telling you, it's you know, surgery is my passion. So that's my life, of course. So many a times there are many instances where I've seen females not coming up to the doctor because they're too shy.
Okay.
To show and share their problems. So maybe I thought, like, you know, being a female orthopedic surgeon, you can help out reach ladies.
Yes.
Because they're really hardworking. They, you know, they struggle a lot. They don't think about themselves. They work really hard for their families. They least care about their health.
True.
So being a female orthopedic surgeon, maybe I can motivate them, help them to come out of their you know, that restricted zone and ask for help.
Okay.
Yeah.
That's a really good point, doctor, because even we have experienced a lot of females just sitting back at home and not willing to go and meet a doctor just because of the gender differences.
Yeah.
So I sincerely request all the viewers through this media that you come across any old ladies who are really requiring support towards ortho, please get in touch with our doctor. If at all, if your hubby wants to prepare a surprise dish for you, what would you expect him to prepare?
Probably a bowl full of vegetables and fruits. That's it.
Doctor, there's a serious question behind this. So we see a lot of obese women.
Yeah.
So anything that obesity has to do with knee or joints pain?
Yeah. So at this point of time, I would like to tell you a small incident which happened with our family members. Like she was my distant grandmother. So she was suffering with this knee pains, and then doctors advised her to get a knee replacement done. It was like way 20 years back probably. So doctors advised to get a knee replacement surgery done, and then she was reluctant.
Okay.
So slowly her pains were growing, and then she was growing obese, and because of that heavy weight, she had knee pains.
Okay.
It was like a vicious cycle, and the only point there was to break that cycle. Only option is knee replacement surgery. So she was absolutely reluctant for that, and finally she ended up with she succumbed because of her obesity. So my point here is, so when you are obese and you have knee pains, maybe you need to break this cycle somewhere.
Mhm.
So maybe if you're really too young for this, you can try reducing your weight. If you're really, you can't reduce your weight with your exercises and food, then maybe you have to go for surgery.
Okay.
Yeah.
Doctor, your message to aspiring doctors.
So my message would be like whatever your gender is, whatever your background is, just do follow your passion. Go do surgeries, get that feel, and yeah, be a good doctor, uh, having a real empathy towards patients.
And thank you so much for joining, doctor.
Thank you.
Your short, crisp answers would definitely help someone who will definitely require it. And look forward for more such kind of conversation. Thank you so much.
Thank you.